Hello, I'm Peter Higginbotham, and today I'm going to be talking about the later years of the workhouse from 1834 to 1948. 1834 saw the passing of the Poor Law Amendment Act, which replaced the previous parish-based system of poor relief administration. The new system was based on an area called the Poor Law Union. Poor Law Unions consisted of a number of parishes, typically around a market town. Generally, a union had 20 or 30 parishes, although in rural areas this could be much bigger, and in dense urban areas could be as few as one parish comprising the union. Each union was run locally by a board of guardians, elected by the ratepayers in each area. The ratepayers were still paying for this new system. Each union was expected to provide a deterrent workhouse, a large workhouse to serve the whole union area, and it was designed to be unattractive in character. The new system was really based on an old concept called the workhouse test, the idea that the able-bodied poor, at least, would only be offered the workhouse and not a handout of any sort. And the test of their destitution would be whether they were prepared to enter the establishment. In fact, the 1834 Act had little new in it. Unions, guardians, deterrent workhouses and the workhouse test were all elements of the pre-1834 system, but it brought them all together. And the new system was compulsory, uniform and national. Wherever you went in the country, you would get the same treatment. The new system was run from London by a new administrative body called the Poor Law Commissioners, who were based at Somerset House and who designed and implemented the new system from London. And the ultimate aim of the new system was to put an end to out relief, the handouts which had been a drain on the ratepayers of the country. The introduction of the new system, however, was not without its problems. Although it was rolled out fairly smoothly in much of the south of England, there was resistance in some parts of the country, most notably London, the north of England and parts of Wales. In the north of England in particular, in the manufacturing areas of the West Riding and East Lancashire, there was severe opposition to the new system. It could even be violent. There were riots in the streets, officials were stoned, and the cavalry had to be called in to restore order in some places. In some unions, the rules were relaxed to allow what was called the outdoor labour test to take place. This meant that able-bodied poor could receive out relief in return for doing daily labour, usually at the workhouse premises. Another problem was that the 1834 Act had not abolished local act administrations and Gilbert unions, bodies which had been set up prior to 1834 and whose legal status hadn't been changed in 1834. The persistence of these bodies interfered considerably in some parts of the country with the formation of new poor law unions. And the system was only fully implemented in 1869 when the final Gilbert unions were abolished. Between 1835 and 1840, a good many new purpose-built union workhouses were erected. However, this was not the same story everywhere. Particularly in areas where there had been opposition to the new system, very few new workhouses were built. Instead, old parish workhouses were kept in operation, even though in many cases they were completely unsuitable for their purpose. To help and encourage unions to erect new workhouses, the Poor Law Commissioners issued some model workhouse plans. Typical of the new designs was this one, the Y-shaped or hexagonal plan. At the front of the building was the entrance block. On the ground floor there would be a porter's lodge, and above that the room where the guardians had their regular meetings. The main part of the building was divided into wings where the inmates were accommodated. There would be a men's wing, a women's wing, and a wing for other accommodation including children. The adult wings were divided into a section for the elderly and infirm, and one for the able-bodied inmates. And the space between the wings was divided into exercise yards, and again split by a wall down the middle. And the doors and corridors and so on in the building were arranged so the different groups had no contact with each other while they were in the workhouse. At the centre, in the hub, the master and matron had their quarters on the upper floors, and from there and the windows all the way round, they could keep watch over every square inch of all the exercise yards. Around the outside of the building were various other structures, stables, stores, workshops, laundry, bakehouse, mortuary, and so on, so that the perimeter formed a hexagon. A good example of a Y-shaped workhouse can be found at Warminster in Wiltshire, now converted to residential use. We've got the entrance block at the front, and you can just read above the door it says Warminster Workhouse. And if we take a look, we can see the wings very clearly and the hub at the centre. And the modern fence down the middle more or less exactly matches the location of where the workhouse walls would have been in its day. Other styles of building were adopted. We've here got the Greenwich Union Workhouse. This is what's called a parallel block design. At the front we've still got the entrance block with the Porter's Lodge and so on. The main building, though, rather than radiating from a central hub, is a long building with a corridor down the middle. However, the basic divisions still apply. There would be a male side of the building and a female side of the building, and that would be further subdivided into areas for able-bodied, elderly and infirm, and children. At the rear of the site we've now got an infirmary block providing medical care for the inmates. A similar design was adopted here at Bethnal Green, with a long building with a corridor down its length. This workhouse could accommodate up to 1,400 people. So how did these new workhouses operate? Well, the first thing to say is that entry into a union workhouse was essentially a voluntary process. You weren't put in the workhouse or sent to the workhouse, you were offered the workhouse, or you resorted to the workhouse. Technically, at least, it was a voluntary process, even though in reality you may have had no other option. If you were part of a family, then the general principle was you stuck together. You all went in together and you all came out together. If, say, you were the father of a family, you couldn't dump your family in the street while you went and enjoyed the workhouse, and equally you couldn't abandon your family in the workhouse while you went off on your own. When you arrived at the workhouse, there was an admission procedure. Paperwork to do, you had to have a bath and a medical. You weren't allowed into the main workhouse if you might be carrying anything infectious, and smallpox was a very big concern in those days. So there was a period of quarantine before you entered the main building, and you were issued with a workhouse uniform. When you left the workhouse, it wasn't a prison. You could leave any time you wanted, in principle. However, you couldn't just walk out the door if you were wearing your uniform, because you would then be guilty of stealing workhouse property, and you might get a month's hard labour for your trouble. So there was a control exerted through the uniform. In many ways, the workhouse could be described as a poverty trap. When you left, you weren't given any help to get going again. You weren't given cash to find some accommodation or help finding a job. And it was a poverty trap. For some people, though, they reached the point when they just had enough of the place and they left anyway, perhaps moving to another town or trying to find relatives who could help them out for a while. The thing, though, that people detested and hated above all else about the workhouse was the business of classification and segregation. As soon as you entered the establishment, you were put in a box. metaphorically and almost literally. You were divided up into different categories: male and female, elderly and infirm, able-bodied and children, and all the combinations of those. And each of those groups had its own section of the workhouse, as we've seen. The doors and corridors and exercise yards compartmentalised the building to keep each of those groups separate. There were some exceptions to those rules. Children under the age of 7 were allowed to stay in the women's quarters, and elderly married couples over 60s could in principle ask for a shared bedroom. And just to emphasise the point about the segregation and classification, here we've got the plan of the Birmingham Union Workhouse in 1852, and again you can see very clearly the sections of the workhouse and the walls in between them. And over here we've got the children's section, boys and girls, separated at this end of the workhouse. I mentioned workhouse uniforms. Here we've got some inmates of the Bosmere and Claydon Union Workhouse at Barham in Suffolk. We've got the ladies at the front with a long gown, apron, shawl and bonnet. The gentlemen behind a sort of jacket, waistcoat and trousers, and a flat cap on their heads. The daily routine in the workhouse was very regimented. For able-bodied inmates, in summer, up at 6 in the morning, breakfast and prayers through till 7, and then 5 hours work through till noon. There was then an hour for dinner and another 5 hours work until 6. That was followed by supper and prayers and an early bedtime at 8 o'clock. In the winter it's exactly the same, except you get the luxury of an extra hour in bed in the mornings. And what do they have to eat in the workhouse? In 1835 the Poor Law Commissioners issued a number of sample dietaries or menu plans. This is the number 3 dietary for able-bodied inmates. Breakfast, every single day of the week it's bread and gruel, 8 ounces of bread and a pint and a half of gruel, and a little bit less for the women. In the evening, supper, every single day of the week again it's bread and cheese, 6 ounces of bread and an ounce and a half of cheese. Dinner varies a bit. Most days though again it's bread and cheese. Tuesday some cooked meat and veg, Thursday some soup and bread, and Saturday a bit of bacon and vegetables. But a lot of bread, gruel, cheese and meat and veg just very occasionally. This is the St Pancras Union Workhouse in London, one of the big London workhouses, and we've now jumped forward to around 1900, and there's rather more now on the inmates' plates than bread and cheese. So by 1900 things had moved on. In fact, many aspects of workhouse life changed over the years. It's very easy to get the impression that workhouses were frozen in time in Oliver Twist's day, for example, but many things improved over the years, and that was really due to the change in the population. By 1900 the workhouses were not full of able-bodied layabouts. They were full of the elderly, the infirm, the mentally ill, single mothers and children. Being a workhouse, of course, work was expected from the inmates, at least the able-bodied ones. The women inevitably did the domestic duties: cleaning, laundry, cooking, sewing, scrubbing and so on. They basically ran the establishment. Men, though, did not have an easy time of it. They were involved in things like stone breaking, bashing up big lumps of stone into small lumps of stone. Oakum picking was teasing apart old ropes into their raw fluffy fibres. Bone pounding is bashing up old bones from the kitchen into kind of fertiliser. But again, as time went on and the inmates on average got older and frailer, Lighter work became more common. Gardening, for example, and chopping firewood was very popular because the product could be sold in the local area. And the elderly and the infirm weren't required to work. Workhouses weren't labour camps. However, it was probably a very unexciting place for the elderly and the infirm. They had a day room to sit in, an exercise yard to walk around. They could look forward to the next bread and cheese and look forward to early bedtime, but it was not very exciting. Here are some ladies from one of the Holborn workhouses in the laundry department, illustrating the kind of work that was done, and again the workhouse uniforms worn by the female inmates. This is the former Union Workhouse at Andover in Hampshire. This establishment hit the headlines in 1845. The male inmates here were employed in pounding bones from the kitchen. However, it was discovered that they were being so badly fed that they resorted to fighting over the rotting shreds of meat and marrow left on the bones that they'd been given to pound. And the scandal was so great that bone pounding was abolished as a workhouse task from that point on. The medical care in workhouses also forms an important part of its story. First of all, up until the 1860s, the workhouse was possibly the worst place in the world you'd want to get sick. First of all, the infirmary facilities in workhouses were often old, unsuitable, cramped, badly ventilated and so on. And the nursing was often done by elderly female inmates who volunteered for the work. Often those women couldn't read and write, couldn't read labels on medicine bottles or instructions from the doctor, and they were often drunk most of the time. A lot of the things that were prescribed for the sick in workhouses were things like brandy or other alcoholic beverages for the job. And the medicines prescribed by the doctor often had to be paid for out of his salary, so there was often a rather limited provision of medicines. In some cases, even things like just coloured water was prescribed or given to the inmates. There was a big push, a big campaign for improvement, particularly in London workhouses. In the mid-1860s, the medical journal The Lancet published a series of on-the-spot reports from the capital's workhouse infirmaries, and they really shocked the nation with the conditions that they reported. For example, in 1865, the Shoreditch workhouse was the subject of one of these reports. They found there was no running water from after 5 o'clock in the evening until next morning, poor lighting and ventilations, windows high up on the walls to stop the inmates looking out of the windows. Lots of overcrowding. The space provided for each patient was only a quarter of what was officially recommended. And very poor washing facilities. In one ward, 17 children were washed each day in a bucket, and sometimes several children using the same water and only dried with some sheets. In another ward, 45 men served by only 2 toilets, which only got flushed twice a day, and only 2 paid nurses at that time, both actually untrained, and between them having to nurse up to 600 patients. They were assisted by 40 pauper nurses and helpers who tendencies to drink cannot be controlled, it was said. The ward for insane patients was under the charge of a male inmate who had no knowledge whatsoever of nursing practices. And the food given to the patients lacked meat. The elderly patients were given food that was very difficult to digest, suet pudding being an example of that. There were major improvements in workhouse medical care from the 1870s onwards. First of all, trained nurses became much more common. Florence Nightingale was particularly active in promoting the training of workhouse nurses. And a lot of new infirmary buildings were erected at workhouse sites. often separate from the workhouse itself. The thing, though, that really transformed workhouse medical care was access by non-inmates. From the 1880s onwards, if you were poor and couldn't afford a doctor, then increasingly you would be referred to the workhouse infirmary for treatment. You didn't need to be a workhouse inmate first before your treatment. You just went straight and used the workhouse infirmary. And for many people in this country, the workhouse infirmary effectively became the local hospital. And in many ways, the National Health Service, which began life in 1948, owed an enormous debt to the workhouse medical system. First of all, the practice of free medical care for all at the point of delivery was now long established, and a large proportion of NHS real estate in 1948 was from former workhouse infirmaries. Another part of the workhouse population was the passing tramp, vagrant or traveller. Every workhouse had provision to give 1 or 2 nights accommodation to any passing wayfarer. You were given a bed and food in return for doing a spell of labour in the workhouse. Some workhouses had labour cells like this one. You were given a hammer and a pile of stone, and you had to break the pieces into bits small enough to go through a grid in the wall to the outside. And once your stone had gone through to the outside, then you could go on your way to wherever you were off to next. You weren't allowed to come back to the same workhouse, though, for a month. So tramps often went round a circuit of workhouses which would last a month, and then they could come back to the first one and go round again if they wanted to. The early years of the 20th century witnessed some interesting developments. First of all, in 1904 it was decreed that from that date on, anyone born in the workhouse would not have that fact mentioned on their birth certificate. Instead, there would be an anonymous sounding street address. And this was to try and help remove the stigma from having been born in the workhouse and having the fact recorded on your birth certificate. In 1910, after several years of consideration, the Royal Commission on the Poor Law published its report, and its main proposals were that boards of guardians should be abolished and replaced by county-based administration, a larger area than the Poor Law Union. It also proposed that rather than different categories of inmate being mixed together in a large workhouse, the elderly, the sick, children, the mentally ill and so on, that a number of more specialised institutions should be set up to provide separate care for those different categories. The Commission had a majority report which proposed that new public assistance authorities should be created to replace the boards of guardians, again working at a county level. The minority report had more radical proposals. They wished to abolish the poor laws completely, and they saw the future as being the prevention of destitution, not its relief after it had happened. 1909, the government introduced old age pensions for the over 70s, although in its first year of operation anyone who was in a workhouse or had recently been in the workhouse wasn't eligible. That restriction was lifted afterwards, though. And in 1911, unemployment and health insurance were introduced in a limited way. One of the most prominent opponents of the poor relief system, who'd contributed to the minority report of the Royal Commission, was the MP George Lansbury, later becoming a leader of the Labour Party. In 1910 he published a provocative pamphlet expressing his views entitled "Smash Up the Workhouse." The introduction of the old age pension in 1909 meant that some of the elderly who might otherwise have ended up in the workhouse now were able to stay outside and support themselves with their pension. It also meant that some people in the workhouse could also escape from the institution. You even got couples getting together and deciding that if they pooled their resources, they could live quite happily outside. One such case, with a picture of them here, we've got William Hennon, aged 94, and Fanny Wadhams, aged 80, who in 1911 left the Medway workhouse in Kent to set up Home Together. So when did the workhouse finally come to an end? Well, there isn't a single date that really marks that point. In the early years of the 20th century, county councils and borough councils were taking responsibility for a greater and greater range of local activities, all sorts of things, sanitation, education and so on. And boards of guardians and poor law unions were starting to look increasingly anachronistic and surplus to requirements. In 1929, boards of guardians were finally abolished under the Local Government Act of that year. The following year, 1930, workhouses and the poor relief system were taken over by local councils. Most former workhouses were turned into public assistance institutions. In some cases they became hospitals, and in some large towns they were split into two, a public assistance section and a hospital section, the site carved down the middle. Under council control, public assistance institutions often were very little different from the workhouses they had previously been. They were in the same buildings with the same staff and the same inmates, and very little changed. The rules were relaxed a bit, visiting was maybe easier, the inmates could come and go a bit more easily, but not a lot changed. It was really in the 1940s we had legislation to introduce family allowances, the National Insurance Scheme and the National Health Service, and in 1948 the National Health Service inauguration really marked the end of the workhouse system. Many public assistance institutions joined the National Health Service, often as geriatric institutions. Others were hung on to by local councils and turned into council-run old people's homes. On the 5th of July 1948, the Health Minister, Nye Bevan, formally inaugurated the National Health Service, and it was significant that the proceedings took place at the Park Hospital, Davyhulme, near Manchester, which had formerly been the Barton-on-Irwell Union Infirmary. The workhouse is often painted as a very grim, often cruel institution. Was it really that bad? Well, first of all, workhouse life was certainly monotonous, strict, tedious, uncomfortable, possibly even demeaning. But I think it's often over-painted as being a cruel and abusive place. There were certainly instances over the years of cruelty and abuse in workhouses, but I think that's often overemphasised. There were enormous improvements, physically at least, in workhouse conditions over the years, and especially for the sick, the elderly and children. The food improved, the medical care improved, the buildings improved. By the 1890s, the elderly were getting weekly handouts of tea and tobacco and snuff. They were getting trips to the countryside and seaside arranged, books and newspapers provided. Local groups would come in and do concerts for the inmates. And similarly for children, by the 1890s they were getting books, games, toys provided, and trips organised to the countryside and seaside. The thing though that never went away was the shame of the workhouse. For many people, the workhouse was the worst place in the world you would want to be, and the stigma of entering the workhouse was enormous. People who went into the workhouse, even for a short period, possibly would never ever refer to the experience again, and possibly even never tell their children or even their future partner that they had once been in a workhouse. Now, who have we here? Are they city gents enjoying their lunch break in the park? Or are they inmates of St Marylebone Workhouse in London? This is possibly a bit of a PR shot, but really illustrating how comfortable it could apparently be in a workhouse, certainly for the elderly. We've got the gents here in their lovely garden, their nice uniforms, the newspapers to read, a pipe to suck on. What more could someone want in the twilight of their years? If you want to know more about workhouses, you could visit a number of former workhouses. There are dedicated workhouse museums at Southwell, run by the National Trust, at Ripon in North Yorkshire, and the Guildford Spike. It's a rare example of a surviving tramps block, now partly turned into a museum. There are a number of other museums located in former workhouse buildings, not specifically workhouse museums, but often have part of their display dedicated to their workhouse history. So we've got Greston Hall in Norfolk, the Weaver Hall Museum in Northwich, Vestry House Museum at Walthamstow, the Didderdale Museum at Pateley Bridge, the Thackeray Medical Museum in Leeds, and the Red House Museum at Christchurch. And for even more information about workhouses, visit my website workhouses.org.uk, where you'll find information about virtually every workhouse in the British Isles and lots of background information on the workhouse system. I've also written a number of books on workhouses and the workhouse system, and they're listed there for you to see, and all of these can be obtained from your usual bookseller.